Welcome to Medical Mystery Cases, short tales to ponder, puzzling histories, confounding symptoms, and strange findings lead to diagnosis bewilderment. Tune in for a few minutes and test your skills.
Who's the new kid? He's got some real speed.
That's Derek, the new transfer. Use your hands. Be physical. I'm glad you're here. Derek is having problems with an old rotator cuff injury. He was sidelined with it last year and still causing him pain.
Well, without missing any class time, let's get him an appointment in the clinic and we'll take a look.
Okay, will do. Come on!
Follow me, please. Here's a gown to slip into. Wear the opening in the back, and the doctor will be with you soon.
Okay. Thanks.
Hello, Derek. Derek!
Oh, hey. Sorry, I didn't hear you come in.
Hi there. I'm Dr. Scott. Coach Cameron tells me you're having shoulder pain. Can you tell me about that rotator cuff injury that you had last year?
Sure thing. It happened during our first game of the season. I rushed about 8 yards into the end zone, landed hard, and had about 5 guys on top of me. Didn't know I was even hurt at the time, too. Pumped about scoring. When I was in the locker room, I realized my shoulder was messed up, and I had surgery, then out the rest of the season.
What medications are you taking?
I was taking oxycodone after my surgery, but I quit. Now I take Advil after practice and in the morning when my head hurts.
Do you get dizzy?
Yeah, sometimes. Also constipated. I guess I need more fiber or something.
Derek didn't seem to be on his game. He looked drowsy, and he was slow to respond. When I examined him, his pupils were a little dilated. I want to get an MRI of your shoulder, and I also want you to see a neurologist about the dizziness.
Okay.
The MRI of Derek's shoulder came back, so I plan to talk to him about treatment, probably leading to surgery to repair the rotator cuff. The neurologist ordered a brain MRI and found evidence of mild traumatic brain injury. I called her to discuss the case. Hi, Ruth. Do you have a minute to discuss Derek's MRI scan?
Yes, and I'm glad you called. There is more to talk about.
I think I know where you're headed. You ordered a comprehensive drug screen?
You got it. Derek tested positive for THC, methylphenidate, or Ritalin, and tramadol. With his shoulder pain, undiagnosed concussions, and now depression, he is self-medicating.
Don't they run a drug screen when these kids transfer in?
Well, they should, but the Bulldogs and Wildcats have the most restrictive drug policies in the SEC. But even if they test positive for any drugs on the list, they only miss one game. Regular drug screens don't detect tramadol. Student athletes know this. He might have received an exception for Ritalin. Tramadol will not be detected on a typical drug screening, SAM HSA 5 panel, but it'll show up on more advanced testing. And some are advocating for its inclusion. And methylphenidate, well, it won't be detected either with routine drug screens. I see a lot of athletes given a prescription for it.
It was determined that Derek had developed a dependency. To avoid further opioid use, the orthopedic surgeon opted for preoperative pain management using IV ibuprofen and an opioid-free surgical procedure in coordination with the anesthesiologist. The orthopedist required, by written and signed agreements with the patient and his healthcare team, that the young man not be prescribed opiates for uneventful surgery and that the athlete will not seek or accept opiates from other providers during post-op treatment. Opioid addiction is becoming very common in high school, college, and professional athletes due to painful, recurrent injuries. It's possible to perform a successful surgery without the use of opioids using multimodal pain management strategies. A team approach used by the multiple healthcare professionals involved can best serve the athlete's recovery.
Intravenous ibuprofen, or Caldolor, administered preoperatively should be considered in enhanced recovery after surgery, or ERAS protocols, for the management of postoperative pain, including that of traumatic origin. Patients receiving Caldolor have been shown to experience less postoperative pain and a decrease in their opioid use.
3 days later, Dr. Scott examines Derek.
Hi, Derek. Good to see you up and around. How does that shoulder feel?
It's a little tender when I roll over on it, but mostly good. No pain.
Derek, we're going to keep you in the sling for another 2 weeks, and your first PT session is scheduled for the end of this week. And we want you to continue this for 3 to 4 months. We might be able to get you back in at the end of the season, but we want to make sure you are fully healed and ready to return for the field.
I feel good about it.
The neurologist and I have both spoken to you about the tramadol. We think with the physical therapy, all you will need will be some Tylenol, and she didn't see a need for Ritalin. I didn't use any opioids in your surgery. You probably have seen a lot of your peers get hooked, and we don't want that to happen to you.
My head is clearer now. I don't want to go back to it.
So what are you studying in school now?
I am thinking now about going into physical therapy. I would like to help athletes recover from their injuries.
Our star player had a complete recovery after surgery. He is looking forward to next season with a much clearer outlook. You've been listening to Medical Mystery Cases. If you enjoyed this production, click the subscribe button to be notified of future broadcasts. Also, tune in to On Medical Grounds for in-depth conversations on important medical topics.
Medical mystery cases are developed in conjunction with leading medical and scientific experts. The patient profiles and information presented contain realistic scenarios, data, and outcomes, but are not taken from actual patients and should never serve as a substitute for professional medical advice. The cases are intended for healthcare professionals to gain insight into disease state diagnoses and treatments founded in evidence-based medicine.